Welcome to UNC Children's and the North Carolina Children's Hospital. We are thrilled that you are interested in the pediatric residency program at the University of North Carolina at Chapel Hill. My name is Stephanie Duggins-Davis. I am the Chair of Pediatrics and the Physician-in-Chief for UNC Children's. UNC is a wonderful, wonderful place to work. Our mission is to serve all children across the state of North Carolina and beyond. We feel very strongly about that mission.
Here at the University of North Carolina, we have an incredibly diverse residency training program made up of 90 individuals from across the country and the world. We want to train leaders, and we believe it's important for you to know how to disseminate your innovative scholarship in multiple settings, whether that's regional, national, or international. We are proud to be a public institution. We're proud to be the state hospital for North Carolina, and we serve families from all 100 counties, regardless of their citizenship status, regardless of their ability to pay.
I grew up in North Carolina and have somewhat idolized UNC for a very long time. In medical school and training, when pediatrics felt right, I came here and visited, and it felt like home. The people felt like family. I felt honored to be able to train here.
It is such a privilege to be a pediatrician on a team, to be able to almost co-parent along caregivers of children and watch them from infancy all the way through their teenage years.
The opportunity to learn from not only your team as a whole, but kind of different levels of attendings that work above you, and to kind of grow throughout that process and to have that continuous support.
My favorite part about being a part of this program is watching the career progression of the residents. I love interacting with them on their first day, not knowing where to go and where places are, to watching them grow into running teams and taking care of children.
I met Dr. McNeil Trice when she was an applicant for our program, so it's been awesome to see her progression as applicant, resident, chief resident, student director, and now she's our program director. So it's always fun for me to anticipate who out of the current and recent graduates will be our next program director.
Now, we are a residency within a department of pediatrics, within a medical school, within a hospital system, and within an overall university. What that allows is that whatever you come here interested in, or whatever you develop an interest in while you're here, we're going to have the faculty that have an expertise in that area. And our 3 different training centers offer an unparalleled diversity of patient populations, medical complexity, community versus academic settings. We're going to challenge you in our conference series to think about all the other aspects of medicine, to think about implicit bias, to think about ethical issues in the NICU.
We want to make sure that you are able to train in a setting that explores what you are passionate about. And whether that be research, global health, clinical medicine, or education, we have opportunities within our curriculum to provide training in all of those areas with experts in those areas.
So Carolina has an exceptionally strong research environment. The hospital is essentially surrounded by the entire university. We have multiple schools: School of Medicine, School of Public Health, School of Pharmacy, School of Nursing, College of Arts and Sciences, all essentially like wrapped around the hospital. Research that really spans from the most fundamental to clinical research. So folks who are interested in engaging, there's lots of points of entry.
UNC has just a world-class collection of researchers in many different areas. There's real opportunity for people to come here, join the PSDP, join this residency, and just get an absolutely stellar education and stellar mentorship when it comes to developing basic science careers, especially.
This is, the University of North Carolina, and this is North Carolina Memorial Hospital, and we are the hospital for the people of North Carolina. And so it gives me, it's such a great honor that we're there for whoever comes to us. We're ready.
We see everyone, anyone who's either from the worried well to the critically ill, and we pride ourselves in being able to handle anything that walks through those doors. And I think that's what keeps us coming back.
We recognize that we are housed in a quaternary children's hospital with every pediatric subspecialty available. However, we believe it's important for you to know how to practice medicine in multiple settings, whether that be urban, rural, community, academic, research, or even global health. And we provide training opportunities and educational opportunities in all of those settings.
UNC's PICU is a 20-bed unit with 12 PICU beds and 8 CICU beds. We have more than 1,200 admissions each year, which ensures a broad exposure to all aspects of critical care. We have a very active ECMO program with new state-of-the-art equipment that provides support for a wide variety of critical conditions. UNC is home to our state's burn center, which provides a tremendous opportunity for our fellows and residents to co-manage along our burn center ICU physicians. The residents at UNC do 2 months during their second year in the PICU.
Even as a student, one of my mentors was someone who worked in the PICU named Benny. Everybody knows who Benny is. He's still here. He's my boss now. And he has took me under his wing when I was a student and has really guided me and mentored me through my whole career.
UNC is a level 1 pediatric trauma center that offers a full range of primary, tertiary, and quaternary subspecialty care 24 hours a day and 7 days a week for our pediatric patients. During their residency, our residents get experience in our pediatric emergency room, learning procedural skills as well as point-of-care ultrasound. At UNC, our patients have access to all pediatric subspecialties, both in an inpatient and outpatient setting. Our outpatient subspecialty clinics are located both at the UNC hospital as well as in Raleigh, and our residents have the opportunity to rotate through both of these sites.
Our pediatrics patients are cared for on the 5th, 6th, and 7th floor of the North Carolina Children's Hospital. We have intermediate care beds located on floors 5 and 6. Each child has a large, all-private room with their own bath and built-in sleeping accommodation for parents. Our epilepsy monitoring unit is located on the 6th floor with rooms equipped with video and EEG capabilities. On our 7th floor, we have a teen lounge, a play atrium for the younger children, a Ronald McDonald House for the families, in addition to a hospital school. All of our residents provide care for the patients in the Children's Hospital with the help of ward team coordinators. They help to reduce the resident workload by assisting with orders on rounds, facilitating discharges, arranging procedures, and providing continuity of care.
I mean, I feel like every day I go to work, I'm really excited to come here just because I get to see all the people that I work with who are my friends and are people that I have gotten to know really well. And it just makes it a really fun and energizing place to work.
When I came here and just met some of the people and kind of the family atmosphere and stuff like that, I really just enjoyed the people. And so felt like it was the best place for me to get my training and learn from these people. You know, you can be as smart as you want as a doctor, but if you can't explain something to people at their level in a way that they understand, it's very difficult for those families to really relate to that and understand what's going on in the care of their child. So when people can really connect with the families and with the child, I get excited about that.
So I have been here for 31 years, and my favorite role here, there's several roles, is being Vice Chair for Diversity and Patient Engagement for Pediatrics. There are many initiatives going on to really promote diversity and inclusivity, and the goal is to have our faculty, our staff, our learners to all look like the face of North Carolina.
The institution, the faculty that work here, and the residents are so committed to serve the people of the state. It's something that binds together everyone that works here and gives us a really common focus. We have the privilege of serving an incredibly diverse group of patients. It helps you learn how to be a clinician, a pediatrician, and an advocate for all children.
I came here in 2013 for residency. I felt like the residents were a family, and I got that vibe from them, and that really drew me to UNC. I stayed on as the first Peds ID fellow, and I have since joined the faculty here. It's hard to leave once you come to UNC.
Our neonatal critical care center is a 58-bed unit that averages 800 admissions annually. The majority of our neonatal critical care center admissions are born at UNC, with the remainder being referred from across North Carolina as well as from neighboring states. Our residents spend a total of 2 blocks in the NICU, one as an intern and one as a second-year resident. Each resident carries up to 8 infants, including premature infants and term infants with medical or surgical subspecialty needs.
I think one of the wonderful things for our residents here in the NICU is they get to work with providers from across the broad spectrum of healthcare professions, nurses, nurse practitioners, respiratory therapists, in addition to the attendings and subspecialists. We also have a wonderful group of physical therapists, occupational therapists, and speech therapists. And really, all the team is crucial to help care for these vulnerable patients. When you go home at the end of most days, you know you've made a difference in somebody's life. Not everybody can say that. And so it's a real blessing and an honor to be able to do that.
The Center for Maternal and Infant Health is dedicated to improving the health status of North Carolina's women and infants through clinical services, outreach, education, and research. The center coordinates treatments for a wide variety of health problems for mothers and infants, including birth defects like spina bifida, cleft palate, and congenital heart defects. At our Center for Maternal and Infant Health, we're able to offer intrauterine fetal surgeries as an intervention for pregnant women with fetal anomalies.
So in our nursery, we see about 4,000 deliveries a year, and we get moms and babies from all walks of life. And we have moms who have, who have little to nothing, and moms who have their own airplane. But when I walk in the room, they all get treated the same, and they all realize that their baby is important. And for me, that's what I love about my job and about the care that we provide here at UNC.
We are here for the children and families of North Carolina, and we are here to educate the next leaders in our state who will be child advocates. Thank you for being interested in the pediatric residency program at the University of North Carolina.